Good morning, everybody, and welcome to another webisode of All Politics Are Local. I'm WSAV.com now reporter John Dowding. Every week, we take the time to break down those big political headlines to talk about what impact they have on us right here in the Coastal Empire and Low Country. Now, this week, we're going to be shaking things up a little bit. Normally, we talk to our WSAV Washington correspondent, Kellie Meyer. She is here, and she's on standby waiting for our conversation. But we're also going to have a conversation with our Georgia Capitol reporter now, Archith. He's going to join us every week as well to talk about those political stories coming from right here at home in Georgia, in Atlanta. So we will catch up with him later on in today's episode. But right now, as I said, we're joined by WSAV Washington correspondent Kellie Meyer. Kellie Meyer joining us from Washington, D.C. Hey, good morning, Kellie.
Good morning, John. Thank you for having me.
Of course. Also, we did not plan this, FYI, for those of you watching at home. We did not plan to both be wearing it. We're just proud Temple University alum.
That's right. Great minds.
So let's get started right away, Kellie. One thing that I wanted to talk about was a story you did on Friday, which was this. And I've seen it covered from some of our sister stations, specifically one of our reporters in a reporter I used to work with here in Savannah. She now works in New Haven, Connecticut. She was talking about how the Black community in New Haven and Connecticut has been greatly impacted by the COVID pandemic. And Kellie, you just did a story on Friday where federal officials now are trying to target communities of color to help them overcome COVID and to also protect them more. So Kellie, tell us a little bit more about the story.
Yeah, thanks, John. It all comes together as Congress is looking to pass another round of coronavirus. What can they include in that? So they held this hearing to hear from experts on how COVID is impacting particularly these communities of color. And the witnesses were saying, of course, these are issues these communities have been facing long before COVID, issues with failing public health systems, issues with infrastructure, housing, schooling, education, everything within those communities facing those challenges with COVID on top of that in these areas. They are just seeing the impact in much greater numbers than other communities. And what the witnesses were saying was that these disasters don't discriminate. They're going to hit any area no matter what. So they were calling for a national strategy. They said we don't have one of any kind. They also said that we need more testing, more surveillance, and just overall care for these communities of color.
So specifically, did they mention any specifics, period, I should say, about why these communities are being impacted more? Again, later we'll talk with Archith about a story he did specifically about the Latino community. But what were they saying about some of those risk factors for these communities? Why are they more at risk, and why are they contracting COVID-19 faster than the white population?
Yeah, and I think one of the first witnesses, he had mentioned that we need to fix our broken public health system. He says we as a nation have allowed it to erode over the last few years, and he was concerned about the leadership currently in this country to address that. So it was a Democratic hearing in the House led by the Democratic majority as they look to pass, of course, as we mentioned before, the HEROES Act and pass this another round of coronavirus relief. But they're just saying there's just these barriers that these communities have been facing, like I said, long before COVID came along, that with a disaster on top of their already challenges they're facing in these communities, whether it be from infrastructure or to education or beyond in public health, they are being impacted disproportionately. And it shows in the numbers that these witnesses presented in the hearing.
And I think you brought up a great point, is the fact that what they're saying is these structures, these communities, not these communities, but the resources to these communities, I should say, that was already fractured. And so now this pandemic kind of just blew it out and just kind of, blew out any...
It just highlights the cracks, yeah.
It just really just highlights the cracks in the systems for these communities. What specifics do we see in the HEROES Act to address this? What does this look like? What would it look like for people like here in Savannah, people living in a community of color here in Savannah? What would these sort of resources and allocations of resources look like for us?
Yeah, that's a great question. And what lawmakers were saying, it's as simple as getting these communities testing getting them PPE, getting surveillance of these cases, following the contact tracing, following how these cases are rising in these communities, just overall care, as I was saying, just paying attention to these communities, and they're pushing for that in this. So the hearing is really just to collect the information, and then these lawmakers can take that as they craft to, like you said, find out how they can address it and how they can answer the need in these communities. But really, you're seeing again that push for testing, the push for protection, as we're saying, to mask up, to socially distance, the education of what they should need. They also said there's been misinformation spread in these communities. People are going specifically to minority communities. They say go to a synagogue and say, spread the virus there. They're even specifically targeting these areas and sharing information for people to go to these places and give these people the virus in minority communities. So there's so much happening. And I know we touched on before we started talking as well about the dangers of another natural disaster, a hurricane, to hit these already struggling communities. They asked about how they can address that better as well. So there's a lot that they touched on that day. And they mentioned that in the hearing Friday. Let's take a listen.
I remain concerned that the coordination and the leadership isn't there. The flyers that basically said, if you're infected, go to a synagogue. If you're infected, go to a low-income community.
There's definitely, my biggest question, honestly, Congress is getting ready for their summer recess. Obviously, you said last week, we talked about this last week, things are slowing down on the Hill. What's the chances of this actually getting passed? I know there's still these hearings going on that may add more amendments or areas to this bill, to this HEROES Act, but what's the chances of this actually getting passed?
And that's a great question and a big question at this hour. And we are seeing a shift from Republican leadership, specifically Kentucky Senator Mitch McConnell, who is the Senate Majority Leader. Initially, he said, let's see how the first round of funding goes into effect and let's wait and see. And he shifted on that wait and see to, okay, let's make something happen. Let's add some more funding. Of course, we have the unemployment insurance running out at the end of the month. They're looking at maybe addressing that, maybe not being as big as a $600 payment, but continuing that on because, as you know, and as many communities know, we are still in the thick of this pandemic.
Especially even communities here down south, it's you said we're still in the thick of this, but it seems like for a lot of our communities down here in Georgia, Florida, South Carolina, we're getting into levels of the pandemic that were first seen in the first New York, New Jersey, Connecticut, and the Northeast, and now the new epicenter is shifting down here. Like you said, it's definitely highlighting the cracks in these communities, in the resources for these communities of color. So Kellie, kind of shifting gears here, we're going to touch more on that locally, that story, when we talk with Archith a little bit later. But shifting gears a little bit, what can we expect from the Hill this week, from Washington in general? What are some big things that we can expect to be keeping an eye out for as the week progresses?
Well, like you said, they are still on recess. They are doing some virtual hearings, like we had that COVID hearing on communities of color. That was on Friday, so they are picking up with some more. School is a really big one. Should the kids go back to the classroom? Should they not? You're going to see more hearings debating that issue as it's a huge topic across the country. July 14th, we're getting closer and closer to kids getting back. What's the right way to do this? So keep an eye on that conversation. That's going to be a big one up on the Hill. And then as the lawmakers continue to filter back in here to Capitol Hill, it will get busier. I'm over at the White House this week, so I was there yesterday following police reform as they had an event with some officers and people who were positively impacted by police officers. Today we'll be heading over and talking with EPA Administrator Wheeler as he prepares to head out to your state tomorrow with the president. I know you're going to touch on that more coming up.
And we'll be joined by Archith in a few. So thank you, as always, Kellie, for talking with us and helping us catch up on some things.
Thank you so much. I truly appreciate it.
And we are now joined by WSAV Georgia Capitol reporter Archith Seshadri. He is joining us live from Atlanta. Hey, Archith, how are you doing this morning?
Hey, I'm doing well, buddy. Thank you so much for asking. Hope you're doing well, too.
Thank you. Thank you for joining us. We're so excited to have you join our conversation. You cover such an important angle for all of our Next Star stations here in Georgia, being able to, hold our reps accountable in the state legislature. So thank you for joining us, and we look forward to all the conversations we're going to have once a week now. It's kind of a good way to jumpstart us into the week, kind of talking about what we can expect. So yeah, let's get started. I wanted to bring up the story. It's kind of funny because it mirrors what Kellie did last week in Washington. She covered a story about, and her and I just finished talking about that, federal legislators and federal officials talking about creating and addressing communities of color specifically who are dealing with the COVID pandemic. So you covered a story yesterday about how specifically in Georgia, they're looking at how COVID is impacting the Latino community. So tell us a little bit about that. What are the reasonings behind that? And what are some of the people you talk to? What are they saying about that?
Yeah, John, very interesting with that because now it's been about 4 months. So there's a lot more data out there. There's a lot more information about the type of patients, the type of demographics. And we spoke to doctors with Emory University Hospital here in Atlanta. And they tell us that one of the populations most impacted are Latinos. And the reason for that is the type of places they typically work, also their housing conditions when they come back home. A lot of Latinos and Hispanics are usually multi-generational. So they're living with their parents, their grandparents. So there's a lot of people in typically a tighter space. So even if one person contracts COVID-19, the way it could spread is much more faster just because of those living conditions. And many of them, they work in the service industry. They're waiters, they're cooks in kitchens, they work in poultry plants. And one of the doctors said that Northeast Georgia, Gainesville, is seeing about 25% of poultry workers who are Latino are testing positive. So that's 1 out of every 4. So that's why they're saying that there is just, sometimes there is these socioeconomic disparities that unfortunately put some racial groups, some minority groups more at risk. Some people are able to work from home, but if you're a poultry worker, there's really not a whole way you can cut a chicken from your house. Or if you're a waiter, and this was before the shutdown, you have to go to work. You can't work remotely. So Emory doctor is saying Latinos certainly more affected, sometimes 4 to 5 times at greater risk than white Americans.
So with that in mind, what are experts saying that our lawmakers, our officials can do to protect some of these communities? In talking with Kellie, they were talking about, they would address this federally through a potential rollout approval of the HEROES Act, which would be the next, rollout of federal relief. But on a state level, what can officials here in Georgia do to try and protect those communities?
Well, I think one of the biggest things that needs to happen at the state level, at least for right now, is sort of the consistency in the messaging. I think we've seen a lot of local city mayors who have mandated mask policy, including Savannah's, including Atlanta's, Augusta's, but from a state level, the governor has not. So there's a little bit of that friction, a little bit of that inconsistent brand messaging, and whether or not someone should absolutely wear a mask and whether or not they'll get fined. The other thing that some of the experts at Emory told me was language barriers for Hispanics could also prevent them from even getting tested. Whether or not they should get tested because they find out they are positive, perhaps they absolutely rely on that paycheck and they can't afford to miss going to work because they test positive for COVID-19. The other situations are immigration or job status. They see the National Guard. Governor Kemp recently rolled out saying another 1,000 National Guard members will be deployed. But for someone who's not as familiar with the process, when they see someone in uniform, there is that level of anxiety and concern that could they face deportation? Could they face some kind of backlash simply because they don't perhaps speak English as fluently, because of their racial demographic? So there is a little bit of that stigma associated. But I think here at Georgia, we have seen the numbers grow exponentially. Back in March, the first week of March, we were there at the governor's office. There were the first 2 cases. Now we're well past July, and we are at an extraordinary number. More than 3,000 people in Georgia have died. 110,000 people who have tested positive. And the rate of people testing positive also has increased. Now we're at 10%. About 10% of people who are testing positive. So we're not maybe as bad as New York or Florida or California, but still Georgia is one of those states that is seeing those numbers grow. And right now the bigger concern is schools reopening. So it's not only the racial or the minority groups, it's, it doesn't feel like it was that long ago when schools shut down in March. Yeah. And now as we get closer to August and September, should they reopen? Should parents send their kids to school? Teachers even concerned. So now we have a new puzzle in this already complicated mess.
And I think you brought up a great point about the language barrier. I actually was reached out to during the really rough part of the pandemic when it first started. by a couple of people from the Latino community here in Savannah, and they were asking on behalf of people who are undocumented that they knew. They were like, can they even get a test if they're undocumented? Because they didn't know. And I personally, actually, I wasn't aware myself. Obviously, I did a little bit of research, looked it up, and if you're undocumented, you still can get a COVID test at some areas in Savannah and some of the testing sites through either the health department or through private companies, organizations, doctors' offices, stuff like that. But again, there's just so many questions that the America as a whole doesn't know the answers to, let alone an immigrant community that also has a language barrier. So I think your story yesterday really brought up a sobering truth that's going on right now during the pandemic.
Yeah, absolutely. And, I was going to also add really quickly, there was that COVID hotline. So I remember when this rolled out by the state, I believe that there was also one for set up in Spanish for those people who perhaps English wasn't their language. So I think there has been some rollouts, but as you pointed out, John, I think one of the biggest concerns, I think at this point, is consistency. For example, my mom went to get tested this week. She didn't have any symptoms, but just to be safe, she's immunocompromised, she's a cancer survivor. Luckily, she's okay. But just the testing, and to sort of see it as from a citizen's lens, it took 2 hours just to get tested, and she had an appointment. To go there were only 6 cars, and the sheer amount of waiting time. And I mean, not everyone has that luxury, right, of 2 hours to go and get tested. And they didn't ask her for insurance, which was interesting, but it's perhaps maybe because she had a doctor referral. But at the same time, the license, they asked her for ID. So as we talked about this whole situation, perhaps people who don't have an ID or are a little concerned, some of these racial groups could be worried that, I don't want to get tested because I don't want to risk that. Hey, I might get deported. I might get this. So I think there needs to be a lot more clarity on, if you're concerned, how do you get a test? What is the easiest way to get a test? And should it really take this long? 2 hours. Yeah. And I mean, there were 6 people in line. So that's 3-4 people per hour, which I think was definitely slow. I mean, that's one center, but still very surprising.
Oh, yeah, I understand. I mean, but I want to really quickly touch base on this before we go. We had big news coming out from a federal judge's ruling, specific on the Georgia heartbeat bill, which basically says that abortion would be considered illegal once a fetal heartbeat is detected. That was one of the strictest abortion laws that we saw come into, that was signed into law, I believe it was last year. And now we have a federal judge halting the bill, the law, and kind of leaving the ruling up in the air. Really quickly before we go, Archith, I want to ask you, what are you hearing from some of our lawmakers, specifically Governor Kemp? What has he been saying about this federal judge's ruling?
Well, really quickly, in terms of what exactly this entails, the governor's office, in fact, tweeted out saying that they will appeal the court's decision, quote, saying, Georgia values life, and we will keep fighting for the rights of the unborn. This came out in a tweet by the governor's office on Monday. So what exactly is the response to this? This is after U.S. District Judge Steve Jones basically came and said that this heartbeat bill is unconstitutional, and it is a woman's right whether or not she can have an abortion or not. I think it's up to 20 or 22 weeks. The original House Bill 481, this was a very controversial bill last year. If you remember, there was a lot of production companies, entertainment companies saying that if this goes into law in Georgia, they will pull out production. This was basically the state telling that as long as they detect a heartbeat, you can have an abortion, and people saying that the state has no rights over a woman's decision whether or not to have an abortion. Typically, that heartbeat was about 6 weeks. So again, on top of this already crazy pandemic, this mess, this is another equation now being added into the governor's office saying they will contest this decision.
It's definitely going to be a topic of conversation tomorrow when the president visits Georgia, something we touched on briefly with Kellie. But thank you so much for joining us, Archith. Really excited to keep our conversations going once a week, to keep everybody informed as we, as the pandemic progresses, and hopefully we find an end in sight to this pandemic.
Fingers crossed.
Thank you so much, Archith. As always, you can see more of Kellie's stories on our website. Just go to wsav.com/Washington, and you can see Archith's stories on our website as well. You can go to his name on our bio pages on our website, and you can always catch up on more episodes of All Politics Are Local. Just go to wsav.com/allpoliticsarelocal. Thank you so much for joining us this week. We'll see you again next week on All Politics Are Local.